All right, so is it time for your doctor to hang it up and become a health coach? That is a question that I've been having to ask myself a lot lately, and I think we should discuss it. So last week we talked about all of the reasons. In fact, it wasn't really all of them, but it was a good amount of reasons why you don't trust your doctor, why you don't believe your doctor, why so many people are making transformations based off the fact that, you know what, I don't care what that doctor says, I'm going to do blank. So we're going to talk about, hey, is just being a doctor enough? Especially when we talk about this kind of rise in the aspect of health and wellness coaching. I have a lot of my colleagues who kind of turn a side eye when they hear about wellness coaches and health coaches. But again, me, right, I got to ask the question, what is it about health coaches and wellness coaches that got people rather listening to them than listening to us, right? So let's start off right where it starts. Some of you may be asking, what is a health coach, right? So I got the Wikipedia definition. Now, obviously, this is the most exclusive definition, but it's the definition. And I think if someone says, hey, what is a health coach? That's what they're going to likely be looking at. Health coaching is the use of evidence-based, skillful conversation, clinical interventions, and strategies to actively and safely, I want to make sure we stress that, engage clients, patients in health behavior change. Health coaches are certified or credentialed to safely guide clients and patients who may have chronic conditions or those at moderate to high risk chronic conditions. Now, all of my physicians are probably rolling their eyes right now when they see the definition of a health coach, because if you know what physicians do, that fits the criteria. And I talk about a lot of times the way we define things plays such a significant role. Again, I suggest you catch last week's episode if you're trying to figure out some of the ways, some of the reasons why people don't believe doctors. But as a physician, I'm looking at this definition yeah, this is what we do. But unfortunately, the general public doesn't. And because the general public doesn't look at our position like that health coaching position, right, we're running into issues, right? So I'm going to talk about some of the ways that your doctor, and if you're a physician listening to this, why you should, become your patient's health coach, your wellness coach. Change. Yeah, we have to change the playing field, because if we don't change the playing field, people are going to keep getting hurt. Chronic conditions are going to keep getting worse. People are going to, again, die because we are not trying to meet our patients, our clients, our customers, because that's what they all are, regardless of how you say it. Whether you call a patient, whether you call them a client, whether you call them a customer, however you want to describe it, you have to figure out, all right, what is it a way that I can try to connect with the patient, client, customer in front of me? So let's talk about it. All right, so shifting from the traditional doctor-patient relationship to a more of a coaching relationship, I think will have significant dividends for our relationship. Again, the doctor-patient, doctor-client, doctor-customer relationship. And one of the reasons why I think it will benefit the patient, but also us, is that as a coach, you can take a more of a holistic approach of how to do things. Because instead of you focusing on just the diabetes or just the blood pressure or just the cholesterol or just the thyroid issues, you're saying, you know what? Let me look at my patient, my client, my customer as a whole and figure out, all right, how do these parts are interconnected, right? Because that's what a coach would do. They would look at it as a holistic approach. Remember, I'm an osteopathic physician. So we already get the benefit of people saying osteopathic physicians are holistic providers. I love it. Not going to knock it. But I love it because what they're saying is, hey, you know what? Osteopathic physicians are more likely to focus on you as a whole and not you as a body part, not you as a disease. And I think that is going to be an important distinction when we're trying to move away from just our doctor role, but more of the health coach, right? You have to be the health coach in your client/patient/customer's life if you want them to get better, if you want them to live longer, if you want them to live a more fulfilling and wellness life. All right, so this is one that you knew I was going to hop on. The fact that health coaches do a much better job at empowering their patients. You know me, you know the motto, empower yourself for better health. That's something I've always tried to bring on and put on my patients. I want my patients to feel empowered about their healthcare. I want my patients to feel empowered about their wellness, their longevity. And I want them to give that information. Again, as a coach, a lot of times all you can do is put the tools in your patient, clients, customers' hands. And I'm going to keep saying it like that because I think a lot of times as physicians, we always want to consider the person who comes in our office, oh, this is my patient. This is my patient. No, no, no. That's your client. No, no, no. That's your customer. You need to be able to use those words in it because, again, I think for some reason we treat a customer better than we treat a patient. We treat a client better than we treat a patient. And we have to let our patients know that you guys are on that same level. So being able to give your patient a sense of empowerment is something that coaches do an amazing job. And as a doctor, as a physician, you need to know, how can I empower my patient to want to take care of their blood pressure, to want to take care of their cholesterol, or to want to take care of their weight? How can I empower them to do so? And if you know the motto, empower yourself for better health. That's the way to go. Let's talk about communication, because as a coach, you allow a more open dialogue with your patients, which then allows you as the doctor to be able to say, hey, you know what? This is how I can take care of my patients better. But if you're just kind of this doctor, you're just kind of in your coat and you're just kind of standing over, or even my practitioners, my PAs, my NPs, and you're just the one just kind of standing over your patient saying, do this, and you're not letting that road of communication be open in a two-way street, guess what? Your patient, your client, your customer is not going to be open. They're not going to be able to kind of say, hey, you know what? These are really all of my issues and my concerns with what we're doing. They're not going to do that. And if they don't do that, guess who can't really do their job? Right? The doctor, the patient. Like, you cannot do your job if you aren't open with your doctor. And as a doctor, you can't do your job if your patient isn't open with you. So as a coaching, right, again, one of these coaching, responsibilities that we need to have is improving the communication between us, right? Just like if you have a client, you want to improve that communication between yourselves. If you have a customer, you want to improve the communication. We have to improve the communication. And I think taking a coaching approach to it does much wonders than our kind of old standard, because clearly that isn't working. You know what? I also believe that coaches do a much better job at setting goals, more importantly, realistic goals and expectations for their clients and for their customers. So as a physician, we have to do a much better job setting goals and expectations for our patients who we are taking care of. So one, that they don't feel like a failure. How many of you have had a goal, and let's say you wanted to lose 100 pounds. You want to lose 100 pounds. But because you don't lose 100 pounds, you feel like a failure. But in all, you actually lost 50 pounds, and 50 pounds is great. But because you didn't lose 100 pounds in whatever time you thought you were going to lose 100 pounds, you thought you failed at the goal. So as a coach has a much better grasp at saying, hey, you know what? This is what I want you to do. This is how I want you to do it. This is how long it should take. Right? As doctors, we're just like, all right, you got to lose some weight. Your blood pressure's got to be better controlled. You got to get your cholesterol numbers down, and we're on to the next patient. If we really want to, again, I'm talking to us. I'm talking to us right now. If we really want to be the best in our profession, if we really want our patients to trust us, to believe us, we have to do a better job coaching them with their goals and making sure that we're setting realistic expectations for their goals so they don't feel like, hey, you know what? I failed that one time. I'm not going to do it again. And we are too busy focusing on specific numbers and not helping our patients meet the goals at hand with some current aspirations and expectations that they need to get to that next level, right? So again, we got to be able to kind of steal some of these traits that the coaches have. We got to take them, and you got to take them in your office or in a hospital, wherever you see patients at, if the goal is to really take care of the patient, if that's your goal. And speaking about goals, when we're talking about motivation and encouragement, Coaches blow us out of the water. I have patients tell me all the time that, you know what, I try to get my blood pressure down, I try to get my cholesterol, and it's just not working. And they feel discouraged. And they feel discouraged like, hey, the medications you gave me is not working, so I'm not going to take those medications. And the diets you told me to do, they don't work. So I'm not like, and coaches are great at saying, hey, you know what, I see the progress that you're doing. I'm going to help motivate you. I'm going to help encourage you. We got to be able to encourage our patients. We got to be able to encourage our clients. We got to be able to encourage our customers to take that next level and understand that, hey, I just want you to put one foot in front of the other, right? Because when you look back, you're going to be 10 steps ahead. But if you keep thinking that, all right, I got to go 10 steps, you're never going to make the first one. So as doctors, we have to do a much better job at putting one foot in front of that other and getting our patients where they need to be. Trust and believe. It's extremely important. Also, the coaching model provides a much more long-term approach to a patient client customer relationship. As a physician, a lot of times it's kind of boop, boop, in and out, see you in 3 months, hopefully get better. If you don't, okay. And patients don't feel that connection. But as a coach, they recognize, hey, we're in it for the long run. I think my concierge and direct primary care doctors do a much better job than the general population at recognizing, hey, this is we're in it for the long run. Like I'm walking with you, lock, step, and key. We're gonna do this together. And in general, the healthcare field, especially as doctors, don't do a good job at recognizing, hey, this is a long-term relationship. And because it's a long-term relationship, I'm gonna let you know that, hey, I am with you. Your customers recognize, hey, I am with you. The client should know I am with you, but your patients don't feel that way. And if your patients don't feel that you are with them, guess what? Right? They know that you're not going to be a person that I can trust in the long term. You're not a person that I can believe in the long term. Coaches do a much better job, and shout out to my concierge and my direct primary care docs, because I think they can do a much better job at recognizing that the long-term relationship of this is gonna produce much more significant results than the short term, see in 2 months, see in 3 months, hope you get better. And we saw the definition. Coaches do a lot better job at educating their clients and their customers to make the correct choices. They do a much better job at it. Now, of course, I know someone's going to hit in my comments, oh, they have more time to do so. Well, you need to make more time to do so for your patient. Like, there's no excuse there. If doctors want to take the approach of being the patient's health coach, they have to do a better job at educating the patient with all of the choices that are in front of them. And I do mean all of them, because we can't just give our one-sided approach and say, hey, this is the only way to do it, when they know there are other people who have done it different ways and gotten better results. So we have to do a better job at educating our patients, our clients, our customers. Again, I don't care what you want to call them, but whatever you call them that gives them the most level of respect, that's what you should be using. Instead of tell your front office, hey, you know what? They're not our patients no more. They're our clients. You know what? They're not our patients no more. They're our customers. And obviously they say the customer's always right. But we have to take that approach to say, you know what? I'm going to educate. I'm going to do a better job educating my client, my customer, my patient, if I want them to have the best opportunity to have the best results. Because again, they shouldn't be going to health coaches when you're the doctor. But they go to health coaches because all you're doing is being a doctor, but you're not doing anything that a great coach does. And we have to be a great coach. I know this is going to be a big one that, the patients and the clients and customers are going to scream from the rooftops. Coaches do a much better job at personalizing their approach. I talked about it last week where I said, hey, you know what? As a doctor, you can't assume that every patient will present the same way. You can't expect that every patient is going to react the same way to your style of, being a doctor. So if you're not saying, hey, you know what? I got this patient right here who likes this approach, I'm going to give it this way. You know what? But this patient over here, my 9 o'clock likes this approach better. So I'll make sure my 9 o'clock gets this approach. If you give your 8:30, your 9 o'clock, your 9:30, your 10 o'clock the same type of approach, someone's not going to be happy and they're going to blame you. Coaches do a much better job at recognizing, hey, you know what? That person right there, I can give them a little bit more tough love. That person right there, I got to go in with kid gloves. Do you recognize the patients in your office that you're seeing that, you know what, probably needs kid gloves versus needs some tough love? And if you don't recognize that, then you know where the problem lies. Again, shout out to my concierge docs and my direct primary care docs. They do a better job at, and this is why, again, for those doctors who are in the traditional sense of the ambulatory settings, this is why you have concierge medicine and direct primary care medicine, because they're taking the skills that coaches do and bringing it to the office. That's why they can see less patients and see and make just as much money as you, because they're taking the skills needed to be a great health coach and bringing it to the doctor's office. So you have to personalize your approach if you want your patient, because again, that should be the goal. If you ask me, if you want your patient to have the best outcome, you have to take the best approaches. And the coaching approach, especially becoming like an individualized expert, that's what you should be, an individualized expert. That is what's going to take it to the next level. And can we say the big A word? There has to be some level of accountability between the coach and the customer, the coach and the client, the coach and the patient, both ways. If your patient's blood pressure isn't being controlled, it's not only on your patient. If your patient's weight isn't going down, it's not only on your patient. If your patient's diabetes and blood sugar isn't being controlled, it's not only on your patient. But a lot of time in the traditional sense as a doctor, we say, hey, all of the good things are a we thing, but all of the bad things are a you thing. How many of you are seeing providers who blame you for not losing weight, who blame you for your blood pressure not being controllable, and everything looks good? They say, hey, we did a great job. Like, how many of that? I know. So we have to make sure that we are accountable and enhancing our accountability, whether it becomes, seeing your patients more frequent follow-up visits, more frequent just check-ins, providing more educational support. We have to have our level of accountability raised if we want to have a great relationship between the coach and the patient, the coach and the client, the coach or the customer. Because at the end of the day, a more satisfied patient, a more satisfied client, a more satisfied customer is going to have better outcomes. That just is what it is. If your patient slash client slash customer is more satisfied with your level of coaching, not your level of care, your level of coaching, they are going to have better outcomes. You just cannot run away from it. So we have to do a much better job at ensuring that our patient satisfaction is priority number one. Because we know if it's priority number one and my patient is truly satisfied, their outcomes are going to be right behind it. And as a doctor who recognizes that being a health coach should be the same thing, but unfortunately is not, especially if you paid attention to this episode, you know that we have to do a much better job instilling a lot of the great things that health coaches do. Or we have to say, you know what? We can't talk about those health coaches. Because I know a lot of doctors who talk about health coaches and wellness coaches. And we say, I don't know why you would go to a wellness coach. I don't know why you would go to a health coach. They go because there's so many different advantages that you aren't bringing to your office. And because you don't think you need to improve, aka accountability, because you don't think you need to improve, guess what? Patient satisfaction drops. And when patient satisfaction drops, patient outcome drops. And if you're asking me, if you want your patient to live the healthiest they can be, to have a life full of wellness and longevity and everything else, we have to, again, I always say it's on us, but that's our responsibility. This is what we sign up for. We have to do a better job at instilling these, right? So again, like I said, a special shout out to my concierge docs out here, my direct primary care docs out here who are taking some of these pieces, they're not doing everything, but they're taking some of these pieces. And because the patients, the clients, the customers recognize that, they're running to them and they're running away from you. Right? So ask yourself after listening to this episode, is my doctor just a regular doctor or are they a health coach?